Inclusion in fire safety is crucial for ensuring that everyone has an equal chance of survival. Excluding individuals with disabilities from evacuation plans can lead to discrimination and increase risks during emergencies. Access to safe egress is not merely about having physical entries, it requires thoughtful planning to ensure that everyone can exit safely. Without comprehensive strategies that address the needs of all individuals, including those with mobility, sensory, and cognitive challenges, we cannot claim true inclusivity. Fire safety preparedness must prioritize the safety and dignity of all individuals. What helping others means. Helping requires structured planning and training to ensure everyone understands their roles in emergencies, allowing for smooth coordination during critical situations. Successful evacuation is reliant on effective coordination among helpers, wardens, and those needing assistance, promoting a system where each person plays a vital part in safety. Assisted evacuation as a staged process. First stage, detection. The first step involves identifying the fire alarm or any signals indicating the presence of a fire, ensuring all occupants recognize the immediate need for action. Second stage, recognition. Individuals must understand the urgency of the situation, recognizing the need for assistance, especially for those who may require additional support during an evacuation. Third stage, decision. At this stage, persons in charge must assess the situation quickly, deciding the best course of action for evacuation while considering the needs of all individuals present. Fourth stage, mobilization. This involves the coordinated effort to assist individuals in moving toward exits, ensuring that everyone is aware of their exit routes and any additional help needed. Fifth stage, movement. This includes the physical relocation of individuals toward safe exits. This is where execution actually happens, and it is often the most vulnerable phase. Sixth stage, handover. This includes transferring responsibility once individuals reach a place of safety. This stage is critical for accountability, coordination, and post-evacuation management. Common barriers. Assisted evacuation is best modeled as a coupled socio-technical process. The building signals and supports egress, while people compensate for functional limitations and for system gaps. Mobility barriers typically dominate vertical egress. Wheelchair users and others who cannot descend stairs independently require either A, a protected waiting strategy, refuge plus rescue assistance, B, a device strategy, evacuation chair, stair chair, rescue sheet, mattress, and clinical settings, or C, an elevator strategy where the building's fire strategy and lift specification supports evacuation use, e.g., occupant evacuation egress elevators under specific code conditions. Sensory barriers often manifest upstream. At detection are recognition and wayfinding. People who are deaf, hard of hearing, may not perceive audible alarms or may receive degraded information. Visually impaired people may face route hazard detection difficulties and require tactile audio cues and consistent wayfinding. Both groups benefit from redundant warning modalities and from signage systems designed for rapid comprehension. Cognitive and neurodiversity-related barriers can increase pre-evacuation delay and misinterpretation of instructions, especially under stress, smoke, noise, or crowded conditions. Medical barriers include fatigue, cardiopulmonary limitations, chronic pain, pregnancy, temporary injuries, and medication-dependent conditions that make rapid descent unsafe without pacing or assistance. Social and organizational barriers are among the most preventable and often the most neglected. They include non-disclosure because of stigma, flawed assumptions that the fire and rescue service will handle it, reliance on a single buddy without backup, staff turnover, visitor management gaps, and lack of rehearsal. Personal emergency evacuation plans. The first step in developing PEEPs is to identify individuals who may need assistance during an evacuation to ensure their specific needs are addressed effectively. After identifying individuals, assess their specific needs regarding mobility, sensory, and cognitive challenges to create tailored evacuation strategies that ensure their safety. After assessing the needs, appropriate evacuation adjustments and necessary equipment are agreed upon in collaboration with the individual, clearly defining responsibilities and ensuring that tailored measures are in place to support a safe and dignified evacuation. Train designated helpers on how to assist individuals during an evacuation, ensuring they understand their roles and the equipment available to facilitate a smooth process. Regularly rehearse evacuation plans with both helpers and individuals, requiring assistance to familiarize everyone with the procedures and identify any potential areas for improvement. The final stage involves periodically reviewing and updating the PEEP to ensure it remains accurate, effective, and aligned with any changes in the individual's needs, staffing arrangements, equipment, or building conditions. Essential equipment for safe evacuation. Evacuation safety is not only about procedures, it is also about having the right equipment aligned with the building's fire strategy and the needs of occupants. We must always remember, equipment should never be selected ad hoc. It must comply with fire regulations and be integrated into the institution's overall emergency planning framework. evacuation chairs. These are critical in multi-story buildings where stairs are the primary escape route. They must be compatible with the staircase design, regularly maintained, and used only by trained helpers. The presence of equipment alone is not sufficient. Competence and rehearsal are essential. Refuge areas and communication systems. Refuge areas provide temporary protected waiting spaces, typically adjacent to stair cores. Two-way communication systems are crucial so individuals can remain connected to emergency coordinators and responders. Life safety communication is a non-negotiable element of inclusive evacuation planning. Evacuation lifts only use lifts specifically designed for evacuation purposes, ensuring they meet strict safety and power standards. Clear signage should indicate when lifts may be safely utilized during emergencies. Visual alarm devices, VADs. For deaf or hard of hearing occupants, visual alarms are essential. Compliance with relevant standards ensures that alarm signals are accessible to everyone. Accessibility must be integrated into fire detection systems from the start. Inclusive signage. Clear signage based on ISO standards improves evacuation flow and reduces panic. This includes multilingual guidance, tactile indicators where appropriate, and universal symbols to support diverse building users. Wardens and buddy systems. Technology alone is not enough. Trained people remain central. The two-deep principle ensures redundancy. If one helper is unavailable, another can intervene. A single buddy system creates vulnerability, while trained wardens provide coordinated oversight. Training, drills, and communication. PEEPs must move beyond paperwork and become part of daily operational practice. Training and drills should include PEEP users and assistants where appropriate, testing equipment, refuge communication, and full evacuation routes at least annually. Regular rehearsal builds confidence, identifies weaknesses, and ensures coordinated response during real emergencies. A common failure is the paper PEEP, a plan completed once, never rehearsed, and outdated due to staffing or structural changes. To prevent this, PEEPs must be embedded into staff inductions, shift handovers, and scheduled reviews with clear accountability assigned to a responsible person. Clear communication is equally vital. Instructions should be standardized, delivered in plain language, and supported by visual, digital, or tactile systems where needed to ensure accessibility and inclusion. Effective evacuation depends on preparation, practice, and coordination, not documentation alone. Now, monitoring and evaluation metrics. An inclusive system should track metrics that reveal whether assistance actually works under stress. First, PEEP coverage tracks the percentage of identified staff, students, or residents who have a current plan in place, as well as the percentage reviewed within the last 12 months, reflecting good practice standards similar to residential review expectations. This ensures that plans remain accurate and up to date. PEEP readiness focuses on operational capability. It measures the percentage of named assistants who are trained and available during each shift, along with equipment inspection pass rates for evacuation chairs, communication points, and refuge signage. A plan is only effective if the people and equipment required to implement it are ready. Time to assist indicators evaluate responsiveness, including the time from alarm activation to helper arrival, the time needed to deploy evacuation equipment, and the time required to reach refuge areas or ultimate safety. These metrics provide insight into practical performance under real conditions. Route and congestion impact assesses whether evacuation device use creates bottlenecks, blocks stairs or doors, or contributes to counterflow or density risks. Inclusive evacuation must not unintentionally increase risk for others. Finally, safety outcomes monitor helper injuries, manual handling risks, distress or injury to assisted individuals, near misses, and the rate at which after-action lessons are implemented. Continuous monitoring and learning close the resilience loop and strengthen institutional preparedness over time. WAR's key takeaways. First, governance is fundamental. PEEPs must be embedded within a clear duty of care framework, aligned with both fire safety and equality obligations, and supported by named duty holders who ensure accountability and continuity. Second, PEEPs must operate as a system rather than a set of documents. The process should move logically from identification and assessment to equipment selection, training, rehearsal, and structured review. The two-deep principle ensures resilience by avoiding reliance on a single assistant. Third, environment and equipment must align with the building's fire strategy. Refuge areas with compliant communication systems, visual alarm devices, trained users of evacuation chairs, and approved lift strategies are not optional additions. They are components of inclusive life safety. Finally, measurement culture closes the loop. Institutions should track PEEP coverage, response times, equipment deployment, congestion impact, injuries, and near misses. What gets measured gets improved, and continuous monitoring strengthens preparedness and institutional resilience. Inclusive evacuation is not a document to file. It is a system to lead, practice, and continuously improve.